The work that I do for the Jerome Golden Center Mobile Crisis Team is really important to me because we're able to reach out to people in the community who need help with their mental health needs and who are in crisis. We've been able to save lives, and it's a lifelong goal for me to be able to work on a team that's so passionate about the work that they do.
I believe that public health is everybody's business, and working in the area with children, K-12 education has been amazing. I am the manager for wellness promotion for the school district of Palm Beach County. It has been an essential piece to contribute not just to the academic area of the growth of children, but looking at the whole child together.
So I'm extremely fortunate that both my parents were in the healthcare arena. My mom was in special education, my dad is a psychologist, and now I feel very honored to be working with the whole community around mental health issues. And as we know, 1 in 4 adults and 1 in 5 children have a mental health condition. So I feel very strongly that we can work together as a community to help reduce the stigma and help folks access mental health services and get them into high quality care and reduce those numbers ultimately.
When I was in college, I met a wonderful professor who told me that statistics are just people with the tears wiped off. And that struck me as being very, very important. And I went on in my career with public health and healthcare administration. And I've been very, very lucky to work with some wonderful people here in Palm Beach County and been able to raise millions of dollars for services for people living with HIV and AIDS, people living with diabetes, people living with cancer, hospice, and many other important causes that impact the quality of life here in Palm Beach County.
The Partnership for Aging in Palm Beach County is really important in this community on micro, mezzo, and macro level. The big picture, doing advocacy and legislative work to make sure that older adults can get their needs met as quickly as possible. And on a community level, a bunch of professionals come together to make sure there are no gaps or to help one another enrich the lives of the older adults in the community. On an individual level, we're providing grants and funding and services to older adults in the community so they can have a really high quality of life.
About a few years ago, my grandmother passed with Alzheimer's, and I saw the wear and tear on my mother with the care for my grandmother. And now that I work for Vitas Healthcare, I see the importance of educating about hospice and the myths that are associated with it. Had we known that hospice was available for my grandmother, I'm sure that would have assisted with my mother and taken a load off of me. As a community educator, I've been an advocate for the community for over 25 years. And in my role as an educator, dismantling those myths, I've seen the lives of people have changed and some of the wear and tear that have taken off the family members. This brings a lot of joy to me, knowing that I've possibly assisted someone when there was the most trying time in their life.
I've been a psychiatrist in Palm Beach County for over 20 years. During this period of time, I have been serving the indigent population both at South County Mental Health Center and Wayside House. I have been treating patients with severe psychiatric illnesses as well as substance abuse issues. During this period of time, I have seen the patients' illnesses grow in severity, the number of patients served increased, and the funding from the government agencies decreased. It is vital at this period of time that we increase our funding as well as increase the number of providers that are available to care for these very ill patients. If this could be accomplished, we would have more wellness in our communities and less tragedies as the recent ones that have overtaken our state.